is Mohammed Shafiq bin Judin. My metric number GGDI2082006. I'm from Polytechnic Nursing Ismail. Today I'm going to present about what is skin cancer. Cancer begins when healthy cells change and grow out of control, forming a mass called a tumor. A tumor can be cancerous or benign. A cancerous tumor is malignant, meaning it can grow and spread to other parts of the body. A benign tumor means the tumor can grow but will not spread. Doctor diagnose skin cancer in more than one year in Malaysia each year, making it the most common type of cancer. If if skin cancer is found early, it can usually be treated with topical medication, procedure done in the office by dermatologist, or an outpatient surgery. A dermatologist is a doctor who specializes in disease and condition of the skin. As a result, skin cancer is responsible for less than 1% of all cancer deaths. In some cases, skin cancer may be more advanced and require management by a multidisciplinary team that often includes a dermatologist, surgical oncologist, radiation oncologist, and a medical oncologist. This, this doctor will meet with patient and together they will recommend the best path forward to treat the cancer. In some instances, the surgical oncologist will recommend a surgery to be performed in an operating room because the procedure to treat the cancer is too extensive for an office setting. Other times, radiation therapy and or treatments using medication given by mouth or by being are recommended by the team either in place of or in combination with surgery. They have four main types of skin cancer. First is a basal cell carcinoma. Basal cells are the round cells found in the lower epidermis. About 80% of skin cancer develop from this type of cell. These cancers are described as a basal cell carcinomas. Basal cell carcinoma most often develop on the head and neck, although it can be found anywhere on the skin. It's mainly caused by sun exposure or develops in people who receive radiation therapy as children. This type of skin cancer usually grows slowly and rarely spread to other parts of the body. Number two is squamous cell carcinoma. Most of the epidermis is made up of flat, scale-like cell called a squamous cell. Around 20% of skin cancer develop from the skin cell, D cell, and these cancers are called squamous cell carcinomas. Squamous cell carcinoma is mainly caused by sun exposure, so it may be diagnosed on many regions of the skin. It can also develop on skin that had been burnt, damaged by chemicals or apples to, to add swelling. Squamous cell carcinoma is commonly found on the lips at site of long staining scar and on the skin outside the mouth, anus, and a woman's vagina. About 2% of about 2% to 5% of squamous cell carcinomas spread to other parts of the body, which makes it more likely to spread than basal cell carcinoma. The number three is micro cell cancer. Micro cell cancer is highly aggressive or fast growing. Where cancer it starts in hormone producing cells just beneath the skin and in the hair follicles. It is usually found in the head and neck region. Micro cell cancer may also be called neuroendocrine carcinoma of the skin. It's just like a pimple. Melanoma, where the epidermis meet the dermis, there are scattered cells called melanocytes. These cells produce the pigment melanin, which gives skin its color. Melanoma start in melanocytes, and it's the most serious type of skin cancer. There are some ways to prevention skin cancer. Different factors cause different types of cancer. Researchers continues to look into what factors cause non-melanoma skin cancer, including way to prevent it. Although there is no proven way to completely prevent these diseases, you may be able to lower your risk. Talk with your health team for more information about your personal risk of cancer. Reducing exposure to UV radiation, particularly by reducing time spent in the sun and avoiding indoor training, lower the risk of developing skin cancer. It's important for people of all age and is especially important for people who have other risk factors. Sun damage build up over time. There are the following step can save you from skin cancer is limit or avoid direct exposure of to the sun between 10 a.m. and 4 p.m. Wear sun protective clothing including white brine, hat, the shade the face, neck and ears. Clothes made from fabric labeled with UV protection factor UPF may provide better protection. UV protective sunglasses are also recommended. Use a broad spectrum sunscreen top for the year that protects against both UVB radiation and SPF 30 or more. Apply at least 1 ounce of sunscreen of your entire body every 2 hours or every hour after having sweating or being in the water. Avoid vertiginous sunbathing. Do not use sun. Don't use sun lamps, tanning beds, or tanning salons. Examine the skin regularly. They should include examination by a health care professional and self-examination. In research taking 500 ml of nicotinamide, a form of vitamin B3, as a tablet twice daily, show radiation in skin cancer other than melanoma by 33% in people who had 2 or more previous skin cancer. Talk with your doctor before taking any supplements. Limiting your sun exposure may reduce your body production of vitamin D, although some research suggests that most people may only need 15 minutes of sunlight exposure daily to produce enough vitamin D. People with limited sun exposure should talk with their doctor about how to include good source of vitamin D in their diet, including the use of supplements. The level of vitamin D can be checked by your doctor using simple blood tests. The treatment for skin cancer are the cancerous skin lesion known as actinic keratosis will vary depending on the size, type, depth, and location of the lesions. Small skin cancer limited to the surface of the skin may not require treatment beyond an initial skin biopsy that removes the entire growth. They have an additional treatment if we need. Option may include freezing, that your doctor may destroy actinic keratosis and some small yearly skin cancer by freezing them with liquid nitrogen that called cry, cryosurgery. The dead tissue slow the dead tissue slows off when it thaws. Excisional surgery. This type of treatment may be applied for any type of skin cancer. Your doctor cuts out a size the cancerous tissues and a surrounding membrane of healthy skin. A wide excision removing extra normal skin around the tumor may be recommended in some cases. The third is a Mohs surgery. This procedure is for large requiring for difficult to treat skin cancer, which may include both basal and squamous cell carcinomas, is often used in areas with necessary to conserve as much skin as possible, such as on the nose. During Mohs surgery, your doctor remove the skin growth layer by layer, examining each layer under the microscope until no abnormal cell remain. This procedure allows cancerous cells to be removed without taking an excessive amount of surrounding healthy skin. Curettage and electrodesiccation or cryotherapy. After removing most of the growth, your doctor scrapes away layer of cancer cell using a device with circle blade that we call curette, and let needle destroy any remaining cancer cells. In a variation of this procedure, liquid nitrogen can be used to be freeze the base and edge of the treat area. These simple quick procedures may be used to treat basal cell cancer or thin squamous cell cancer. Radiation therapy. Radiation therapy uses high power energy beams such as X-ray to kill cancer cells. Radiation therapy may be an option when cancer cannot be completely removed during surgery. Chemotherapy. In chemotherapy, drugs are used to kill cancer cells. For cancer limited to the top layer of skin, creams or lotion containing anti-cancer agents may be applied directly to the skin. Systemic chemotherapy can be used to treat skin cancer that have spread to other parts of the body. Photo, photodynamic therapy. This treatment destroys skin cancer cells with combination of laser light and drugs that make cancer cells sensitive to light. Biological therapy. Bio- Biological therapy uses your body immune system to kill cancer cells. That's all for me. I hope you all understand what I have tried to convey about skin cancer. I hope you enjoy watching this, and thank you.